Alzheimer's disease. Alzheimer's disease is a brain disorder that slowly destroys memory, thinking skills, and can hinder those affected from performing simple tasks such as brushing their teeth, bathing, or tying their shoes. Alzheimer's disease affects men and women of all races, backgrounds, and ethnic groups. In most cases of Alzheimer's disease, symptoms first appear when people are older. Estimates vary, but experts suggest that more than 6 million Americans, most over the age of 65, have dementia caused by Alzheimer's. Dementia is the loss of behavioral abilities and cognitive functions such as thinking, remembering, and reasoning to the extent that it interferes with a person's daily life and activities. Alzheimer's disease is the most common cause of dementia in the elderly. Alzheimer's disease stages, signs, and symptoms. The stages of dementia are preclinical, mild, moderate, and severe. In the preclinical stage, changes in the brain do not cause noticeable signs of the disease and can last for years. Symptoms of mild dementia include memory loss, confusion about familiar places, poor judgment, mood and personality changes, and increased anxiety or aggression. Symptoms of moderate dementia include increased memory loss and confusion, problem recognizing close family and friends, repetitive statements or movements, anxiety, wandering in the late afternoon or night, hallucinations, paranoia, and the inability to carry out activities that involve multiple steps in a sequence, such as getting dressed, making coffee, and setting the table. Symptoms of severe dementia include weight loss, seizures, skin infections, difficulty swallowing, increased sleep, and lack of bladder or bowel control. During this stage, the person must depend completely on others for help with basic activities of daily living. Risk factors. The causes of dementia can vary depending on the types of brain changes that might be taking place. Dementia can be caused by abnormal deposits of the alpha-synuclein protein in the brain, FTD disorders that cause loss of neurons, and abnormal amounts of tau and TBD43 proteins, and conditions arising from stroke and other vascular brain injuries. Individuals with a family history of FTD are more likely to develop dementia, and 10 to 30% of FTD cases are deemed genetic. Younger people may get Alzheimer's disease, but it's less common. Dominantly inherited Alzheimer's disease, or DIAD, is a form of dementia caused by rare inherited gene mutations. Anyone born with the mutated genes usually develops the disease before age 60 and has a 50-50 chance of passing the mutation on to each offspring. The mutated gene is identifiable through genetic testing. How Alzheimer's affects the body. Alzheimer's disease is ultimately a fatal form of dementia. Currently, there is no cure for Alzheimer's disease, but early diagnosis is important. If doctors can determine the type of dementia and likely cause, medications can be prescribed to treat symptoms. Medications such as donepezil, an enzyme blocker that restores the balance of neurotransmitters in the brain, and memantine, which blocks glutamate, the amino acid believed to be linked to Alzheimer's, are some of the medications that can help with symptoms. Effects on the body include seizures, difficulty swallowing, increased sleep, and lack of bladder and bowel control. The vast majority of those with Alzheimer's die from aspiration pneumonia, malnutrition, falls, or other infections. Tests and diagnostic tools. Cognitive assessment tools are used to identify individuals who may need additional evaluation. The mini-cog is a 3-minute test consisting of a recall test for memory and a scored clock drawing test. Test results are evaluated by a health provider to determine if a full diagnostic assessment is needed. Researchers have identified certain genes that increase the risk of developing Alzheimer's and other rare deterministic genes that directly cause Alzheimer's. Although genetic tests are available for some of these genes, health professionals do not currently recommend routine genetic testing for Alzheimer's disease. Carrying this gene mutation only indicates a greater risk. It does not indicate whether a person will develop Alzheimer's. PTE imaging scans or PET scans represents a potential major advance in the assessment of those with cognitive impairment. The scan visualizes plaque present in the brain which are prime suspects in damaging and killing nerve cells in Alzheimer's. Before PTE scans, these plaques could only be detected by examining the brain at autopsy. Disease prevention and prognosis. Current Alzheimer's-related studies include controlling high blood pressure, increased physical activity, cognitive training, new drugs to delay onset or slow disease progression, diabetes treatment, depression treatment, sleep interventions, social engagement, vitamins such as B12 plus folic acid supplements, and combined physical and mental exercises. Those with untreated vascular illnesses such as hypertension are associated with a faster progression of the disease. In 2020, Alzheimer's disease was listed as the 7th leading cause of death in the United States, behind heart disease, COVID-19, and cancer. The CDC states that as many as 5.8 million Americans over the age of 65 were living with Alzheimer's disease in 2020. This number is expected to grow to 14 million by 2050. The life expectancy for those diagnosed with Alzheimer's disease varies. On average, people live between 3 and 11 years after diagnosis, but some may survive 20 years or more.